Hi, this is Nurse Angela from Angela's Nurse Toolbox. We're going to do an activity called a dying exercise. Okay, I got this exercise from Teachers Transforming Nursing Education, and I use it in the death and dying part of lectures. So my students can kind of understand the loss of control and the feelings that somebody that they may be caring about may be experiencing. So this is your chance to examine your own personal feelings on death and dying. So I want you to grab some little pieces of paper. It could be Post-it, so tear up into 20 pieces of individual paper. Pause the video while you do that, and now we're going to continue. So on the first 5 slips of paper, I want you to write down 5 possessions or material things that are super important to you, that can hold a lot of value. It could be your home, car, phone, jewelry. So write down only one item on each piece of paper. You can pause the video while you do this. On the next 5 pieces of paper, you're going to write down things that are highly valuable in nature to you. The beach, the sunset, going to the mountains, the rain. So write down those things and pause the video. Then you're going to take out another 5 pieces of paper, and you're going to do important activities like hobbies, reading, camping, swimming, jogging, yoga. So pause the video and do that. In the last 5 pieces of paper, I want you to write down 5 people who are very important to you. They can be living or deceased. They can be pets. And only put one person on each piece of paper. You can pause the video as you do that. Now once you finish, I want you to line up all your pieces of paper in front of you so that you can see everything that you have in front of you that you wrote. Now I'm going to tell you a story. I want you to consider what you would be feeling and thinking about as these events happen to you. It's a warm summer day and you're feeling good, and you go home to take a shower. As you're drying off, you notice something that wasn't there before. It was a lump where it shouldn't be. It's small but painful. Fear strikes you deep. You try to brush it off, thinking you're imagining something it's not. You find you can't sleep well tonight. Despite your wishes, it continues to grow and become more painful. You finally tell a loved one about it and decide to make a doctor's appointment. The process has begun. It's time for you to give away something in your life. So I want you to choose one of your pieces of paper and crumble it up. The next several days, you find yourself in the doctor's office waiting room. You feel nervous. You notice everything in the room. You're feeling anxious. You tell yourself you're making a big deal about nothing. They call your name, and your heart starts beating faster. And you wonder why the doctor is trying to ask you a lot of questions about malignancy in your family history. He says, "Oh, it's probably nothing," he says with a look of worry on his face, "but we ought to do some more tests. I should have them back by Friday. I'll call you." You get into your car. It's 2 more days until Friday. You try to keep your mind off what would happen. Your family is helpful. You keep starting thinking a lot of what if, and how would they make ends meet if you were not able to be here anymore, if you really got sick. You know, a tear comes to your eye. Life is really precious. Your family means so much. Now I want you to take 2 more pieces of paper and crumble them up. Thursday comes along. Now Friday's finally here. You didn't sleep very well. You tell yourself, "Oh, it's probably nothing." You wait all day for that phone to ring. At 2 o'clock, the nurse calls you and tells you the doctor would like you to come into his office to speak to you. Fear strikes you deeper at this time. You're wondering why he couldn't have given you news over the phone. It must be bad news. I want you to give up another piece of paper. So crumble up something else in front of you. The doctor examines the lump again and does some routine tests, tells you to dress, and then meet him in his office. Now he says, "I have some bad news for you." You hear the words surgery, chemo, radiation. That's what stands out. You thought you could take this bad news. You thought you'd be strong. But now loss, grief, fear, and anxiety all have new meaning. I want you to toss away 3 more strips of paper. A week goes by. You've had to take a leave of absence from work or school. The doctor says it might be 6 to 8 months. Money is a problem, but it's a stress you hardly have time to think about with all the appointments, medicines, and adjusting to good and bad days. Things are different now. Life has changed in just a few short weeks. A month goes by. You start wondering why your family and friends haven't come around as much. They think it might be contagious. They don't know what to say to you. You've lost weight. Your hair starts falling out. Your life seems to be slipping away. You've lost a lot of energy. Recreational activities have lost their pleasure. Why even going to the bathroom is difficult. You have changed. Life has changed. Now crumble up 2 more pieces of paper. Several months have passed, and you know you're not getting any better. And the clue that you believe that was the doctor said he's stopping all treatment today. There's nothing more they can do. You're confined to bed most of the time. Your yard is full of weeds. Winter is coming. Family and friends start to come visit you. It starts to dawn you. Death is in sight. Now take away 3 more pieces of paper and crumble them up. On February, the doctor orders more pain medicine. You're nauseated all the time now. Days and nights run into each other. You lie awake wondering if you're dead or you're still alive at all. Life has lost so much meaning. Life is spinning out of control. Now I want you to move your papers around in front of you, close your eyes, and crumble up 2 of them, not knowing what you're crumbling up. You wake up early one morning. Your breathing is more labored. You somehow sense this is your last day. Now take 2 more pieces of paper and crumble them up. Your breathing is more difficult and slower. You feel disoriented. You wonder, are you alive? I want you to take a long, deep breath, hold it in, and let it go. Take another deep breath, hold it in, and let it go. This was your last breath. You have died. Now crumble up the last remaining pieces of paper and give away your last possession from this earth. Now I want you to think about what was the things you've held on to the longest toward the end of this exercise. I'm pretty sure it wasn't material things. That's what's most important in life. I want you to know that now's the time for you to live life to its fullest and to embrace the things and people who are most important to you. I use this exercise in my Death and Dying lecture for my students so that they can understand how it was to feel that loss of control, especially when you closed your eyes and picked 2 of the things that you may have been trying to hold on to the longest. Knowing what a patient might feel like that is experiencing or going through this. I hope this exercise helped you put a new perspective on the meaning of life and caring for our patients. If you like this, subscribe to my channel, Angela's Nurse Toolbox. Have a great day.